Welcome to Nurse Academy. In this video we will walk you through a comprehensive pediatric nursing assessment. We'll cover everything from preparing the environment to performing a full physical exam, along with growth and malnutrition assessments. Whether you're a nursing student or just looking to improve your skills, this guide will help you master pediatric assessments with confidence. Start by ensuring the environment is clean and comfortable. Wash your hands thoroughly. Hand hygiene is the first step in infection prevention. Gather your equipment. Make sure you have the necessary tools: stethoscope, thermometer, blood pressure cuff, pen light, tape measure, and any other pediatric-specific tools. Create a child-friendly atmosphere. Smile warmly to help ease the child's nerves. Let the child explore the equipment if needed. This can help reduce fear. Explain your actions in simple, reassuring language. Involve the parent or caregiver. Having a parent or guardian present can help comfort the child during the assessment. Before physically touching the child, make your initial observations. Appearance. Is the child well-nourished, clean, and appropriately dressed for the weather? Behavior. Observe the child's behavior. Are they alert, active, shy, or perhaps lethargic or anxious? Posture and mobility. Watch how the child moves. Are they limping, stiff, or having trouble with mobility? Speech and cry. Is the child speaking in age-appropriate ways? For infants, is the cry strong and clear, active, alert, and age-appropriate behavior? Lethargy, poor eye contact, excessive irritability, or floppiness? We'll take vital signs in a specific order to minimize distress. Respirations. Start by watching the child's breathing while they are calm. Heart rate. Listen with your stethoscope at the apex of the heart. Temperature. Take the temperature orally, axillary, or tympanically based on the child's age. Blood pressure. Take blood pressure if the child is over 3 years old or if it's clinically necessary. Infant heart rate 100 to 160 beats per minute. Toddler heart rate 90 to 140 beats per minute. Preschool respiratory rate 20 to 30 breaths per minute. Very fast or slow heart rate or respiratory rate. Fever or low temperature. An important part of pediatric care is, evaluating the child's growth and nutritional status. This involves measuring a few key things. First, measure weight in kilograms. For infants, you'll want to use a baby scale. Next is height or length. Measure height or length based on the child's age. For infants, measure length while they're lying down. Head circumference is also important. Measure head circumference for infants and toddlers to assess normal brain growth. Then compare the child's measurements against standardized growth charts for their age and sex to see if they're growing at an expected rate. Now let's talk about signs of malnutrition. If weight for age or height percentiles are falling below the 5th percentile, that's a concern. Underweight means the child's weight is significantly lower than normal for their height. Stunting is when the child's height is below the normal range for their age. Wasting refers to significant muscle or fat loss, which may indicate acute malnutrition. Growth percentile appropriate for age, consistent weight and height gain, those are normal findings. Growth below the 5th percentile, significant weight loss or stunting, those are abnormal findings. Inspect the shape of the head and check the fontanelles, or soft spots, in infants. Look for facial symmetry and expression. Are both sides of the face equal, and are facial expressions appropriate for their age? For the eyes, check for clarity, symmetry, and reactivity to light. When it comes to the ears, look for proper placement, because low-set ears may suggest genetic issues. Check the nose for patency, is it clear, and see if there's any discharge. For the mouth, look for moist mucous membranes, no ulcers, and healthy teeth. Symmetrical face, clear eyes, clean ears, moist mouth, those are normal findings. Bulging fontanelles, which could mean increased intracranial pressure or facial drooping, those are abnormal findings. Neck mobility is next. Can the child freely move their neck, and is there any stiffness or tenderness? Feel for lymph nodes. They should be small, soft, and mobile if you can feel them. Now, Moving on to the chest and lungs, observe the child's breathing. Is it smooth and easy, or does it seem labored? Listen for lung sounds. You're looking for clear, equal sounds on both sides of the chest. Even chest rise and clear lung sounds are what you want to hear for normal findings. Wheezing, crackles, or retractions between the ribs, those are abnormal findings. Okay, so for heart sounds, you'll want to listen at the aortic, pulmonic, tricuspid, and mitral areas. Sometimes you might hear this called APTM. Next, feel for pulses in the brachial, femoral, and pedal areas. Now, when everything's normal, you should notice a regular heart rhythm with no murmurs, although some murmurs can actually be normal depending on the patient's age. But if you hear an irregular rhythm, a loud murmur, or notice weak pulses, that's considered abnormal. Now moving on to the abdomen. First, observe the abdominal shape. Look for whether it's flat, round, or maybe distended. Then you'll want to auscultate the abdomen in all quadrants to check those bowel sounds. After that, gently palpate the abdomen to feel for any tenderness or masses. In a normal assessment, the abdomen should be soft, with active bowel sounds and no tenderness. On the other hand, if the abdomen feels firm, you don't hear any bowel sounds, or the patient shows signs of pain, those are abnormal findings. So start with inspection. Look for cleanliness, redness, swelling, or any discharge. In infants, make sure to check if the testes are descended in boys. Now, moving on to the extremities. Take a look at the arms and legs and inspect for straightness and movement. Check for any signs of cyanosis or swelling like clubbing or a blue tint. Assess their muscle tone by checking strength and joint mobility. Normally, you'll see full movement and strong muscle tone, but if you notice weakness, limited movement, or swelling, those are considered abnormal findings. Next up, assess alertness and orientation. Ask yourself, is the child appropriately alert for their age? For infants, check reflexes like the Moro, rooting, and palmar grasp reflexes. For older children, test balance and coordination with activities like walking or reaching. Now let's talk about the skin. Look for any abnormalities in color, temperature, or moisture. Inspect for rashes, lesions, or bruises, any unusual marks. Normal findings include warm, dry skin with no rashes or lesions. Abnormal findings could be cold extremities, cyanosis, or unusual rashes. Once you're done, thank the child and parent for their cooperation. Make sure to document all findings accurately and clearly. If you notice any abnormal findings, report them to your instructor or healthcare provider right away. Here are some extra professional tips for students. Always observe first before physically examining the child. Be gentle and quick when needed, but always ensure comfort. Keep talking to the child throughout the exam and explain what you're doing. Adjust your assessment based on the child's developmental age. And don't forget to praise the child for their cooperation. Something like, "You did great staying still." Alright, let's do a quick recap. Prepare the environment by practicing hand hygiene, gathering equipment, and creating a friendly atmosphere. Observe the child's appearance, behavior, and posture before you start touching. Take vital signs, measuring from the least distressing to the most. Assess growth and malnutrition by checking weight, height, and head circumference, and use growth charts for comparison. Do a full head-to-toe assessment, examining from head to toe. And finally, document your findings and report any abnormalities promptly. That's it for the complete pediatric nursing assessment. We hope this guide helps you feel more confident and prepared. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more nursing tutorials.